Hi, good evening, ladies and gentlemen. Welcome to the third series of Live Public Forum, part of National Eye Health Awareness Campaign, NEHA 2021, organized by Association of Malaysian Optometrists, AMO, in conjunction with World Sight Day. Thank you to all our sponsors for making our NEHA 2021 campaign a great one. And today's forum session is brought to us by Alcon Malaysia. Those of you joined our last two sessions, welcome back. And those new to our session, you can watch our previous series that discussed on children's eye health and also on digital eye strain. You can watch these two series on our Facebook page and YouTube channel. Okay, ladies and gentlemen, there are around 140 million contact lens users in this world. The number is globally increasing every year due to ease of availability, very cheap price of contact lenses, and its ability to improve our vision without affecting our physical appearance. And also, it's easy to be used for our sports activities, and it also improves our quality of life. And then what happened? The COVID-19 came in. The World Health Organization declared as a pandemic on March 11, 2020 due to COVID-19. This has resulted in substantial change in the international social interaction. There has been a strong emphasis by WHO on hand hygiene, face protection, and avoidance of touching our face, mouth, and eyes to contain this virus. In view of that, we all know that contact lenses wear involves very high contact with our own face and eyes. So, do you think is it safe to wear contact lenses during COVID-19 pandemic? Do you yourself or any of your loved ones wearing contact lenses? Do you think you are at risk of contracting coronavirus by putting on contact lenses onto your eyes? If you have all these questions in your mind, you are at the right forum now. My name is Prakash and I'll be moderating our session today entitled on contact lens wear during is contact lens wear safe during pandemic? We have four dynamic and experienced panelists with me here to discuss and enlighten us on this topic today. Let me introduce them to you. The first one, we have Dr. Vanita Ratnalingam, an ophthalmologist and corneal specialist from OEC's Eye Specialist. Dr. Vanita graduated from University Science Malaysia and obtained Masters in Ophthalmology from University Kebangsaan Malaysia. She further completed her fellowship in cornea and external eye diseases at the prestigious Royal Victorian Eye and Ear Hospital in Melbourne, Australia. She sees many contact lenses related eye problems on regular basis at her practice. So I'm very sure that Dr. Vanita has a lot of sharing for us today related to contact lens wear during this COVID-19. Hi, Dr. Vanita.
Hi, Prakash. How are you?
I'm good, Dr. Vanita. Thanks for being with us today.
It's my pleasure.
Thank you. All right, so now the second panelist, we have Dr. Muhammad Afzam Shah bin Abdul Rahim, the Assistant Professor and Lecturer from Department of Optometry and Visual Sciences from International Islamic University, Malaysia. Dr. Afzam is involved in the Conjoint Contact Lens Committee, Malaysian Optical Council, and he is also a panel for optometry program accreditation of the Malaysian Qualification Agency, MQA. Dr. Afzam is very keen on the management of myopia, and with support of his university, he has established a myopia clinic at his university. Dr. Afzam's PhD was in the areas of smart devices and visual display unit. As part of his PhD training, he invented the open field tear film analyzer, which is very much related to contact lens use. His current research interests include contact lenses and dry eye, myopia control, and the impact of smart devices on the visual system. Hi, Dr. Afzam.
Hi, Mr. Prakash. Thank you very much for having me here. It's definitely a pleasure to be here.
Thank you. We are looking forward for a very great sharing of yours. Now, our third panelist is Ms. Liu Mei-Ling, a clinical optometrist and a managing director from Home and Work Optometric Care. Ms. Liu is an optometrist by profession, for the past 23 years. She has graduated with the Bachelor of Optometry from University Kebangsaan Malaysia in 1998. Ms. Liu has vast experience in clinical optometry practice, myopia management in children, specialty contact lenses fitting, as well as orthokeratology. Hi, Ms. Liu. Welcome to our series.
Good evening, everyone. Good evening, Prakash. And thanks to AMO for the invitation and opportunity given to share this topic tonight. Thank you.
Thank you. And the last but not least, we have Ms. Georgina Tay, Alken's Professional Affairs Executive and Optometrist. Ms. Georgina is a certified optometrist with a bachelor degree of optometry from NIOS, the academic arm of Tun Usinor National Eye Hospital. She has past 6 years of retail experience working as an optometrist, handling eye refractions and contact lens fitting to help more people to see clearly and achieve better quality of life. Ms. Georgina also holds a certificate as a certified professional MC and has hosted several corporate seminars and nationwide launching events. Prior to joining Alken, Georgina is also associated with AMO as spokesperson for Eye Care Health Awareness NEHA campaign that are held annually by AMO. Currently, Georgina is attached to Alken as professional affair. Hi, Georgina.
Hi, Prakash. Hi, everyone. Thank you for this opportunity here today, and I look forward for the upcoming session.
All right. Thank you. Thank you, panelists. We have wonderful panelists over here. So we are very excited to learn about the contact lens wear during the pandemic. But there are still many questions about what can and can't increase your risk of contracting coronavirus. One question is whether is it safe to wear contact lenses or contact lenses wear can increase your risk of getting COVID-19. So let's direct our question to Dr. Vanita. Hi, Dr. Vanita. We would like to know, can COVID-19 affect our eyes in any way?
Yes, COVID-19 can and has affected the health of our eyes. As we know, symptoms of COVID-19 generally involve the respiratory system, but other organs can be affected as well, and the eye is not spared. So a small portion of patients may develop an infection of the eye known as conjunctivitis. And this is basically an infection of the surface layer of the eye where patients present with symptoms of redness, mucus or watery discharge, and a scratchy or sandy sensation in the eye. But other ways that the pandemic has affected the eyes is through lifestyle changes. For instance, we have seen that there has been an increased incidence in myopia or short-sightedness among children. And this is because of the lockdown. Children are indoors, unable to go outdoors. So a lot more time is spent on near work, on the tablet, on the handphone, and also because of online schooling. So all this near work and lack of outdoor activities has increased the incidence of myopia. Even in adults working from home, you tend to spend more time on the computer, and prolonged screen time has increased the incidence of dry eyes and definitely aggravated the condition. So these are just some of the ways that the pandemic has affected the health of our eyes.
Right. Thank you, Dr. Vanita. So we can see that direct and indirect effect to the eyes by COVID-19. Right. So with that, I would like to ask Dr. Afzam. We saw that COVID-19 can affect our eyes. How about contact lens wear? Do you think wearing contact lenses during the season of COVID-19 imposes any harmful risk? Is it safe to wear contact lenses?
Thank you very much for the wonderful question, Mr. Prakash. And yes, that's a really genuine question. When it comes to contact lens, we do all know that contact lens is really a small device which we put on top of our cornea or our clear part of the eyes. Now, that's a really big thing to be concerned of, particularly because we need to touch the contact lens and then touch our eyelids and also touch our cornea. So to answer this question, I would like to refer to the Center for Disease Control in the USA. And the CDC mentioned that throughout their investigation, there has not been any cases or any signs of contact lens wearer being more prone to getting COVID-19 compared to spectacle wearers. And at the same time, coming from the academic background, I would like to bring our attention to the prominent Professor Lyndon Jones, who is actually the director of Center for Ocular Research and Education at the University of Waterloo in Canada. And quoting what he said, contact lens remains a perfectly acceptable form of vision correction even during this COVID-19 period, provided that the patients always practice good hand hygiene and follow all the appropriate lens care methods being prescribed by the optometrist. And lastly, my colleagues from the Manchester University, Professor Philip Morgan, had conducted this study to see whether contact lens wear is actually impacting or associated with COVID-19. And based on that particular studies, they found out that there's actually no relationship whatsoever when it comes to COVID-19 and contact lens wear. Of course, you always have to have really good hygiene when it comes to handling contact lenses. So that's my answer. Thank you.
Thank you, Dr. Afzam. So we are pretty sure that our studies have proved that wearing contact lenses with proper care doesn't impose any risk of getting COVID-19, right? Okay. So next question arising from Dr. Afzam's explanation. Ms. Liu, do you think there is any special care, steps or measurements that we need to take when we're wearing contact lenses during this pandemic season or in general?
Yeah, thank you for the question. I think this is a very common question asked among the contact lens users. In fact, quite a number have, posted this question whether it is safe to use contact lenses during the pandemic. And I believe Professor Afzam just now have actually given a very good explanation there. It is, in fact, a misinformation that contact lens users should not use their contact lenses during the pandemic. As to date, there's no literature stating that contact lens users pose a higher risk of getting infected by COVID-19. So if you have been a contact lens wearer all this while and have been practicing proper steps of handling contact lenses all this while, that should not be very much different during this pandemic as well. Okay. However, if you have not been following the steps, guided by your fellow contact lens practitioners, then these are the areas you should pay attention to. Number one, hand washing, the most essential number one step in fighting against eye infection and the spread of COVID-19 virus. So therefore, pay extra attention to hygiene and do not touch your eyes before washing your hands, and do not handle contact lenses immediately after sanitizing your hands with alcohol-based hand sanitizers, all right? Because the alcohol may cause some stinging sensation. And number two, dry your hands with clean towel or tissue. And number three, keep the environment clean, all right? And do not store contact lens products in the washroom or toilet due to the unclean environment. And number four, rub and clean lenses with multi-purpose disinfecting solution. Do not use tap water or even saline. And number five, always use fresh and clean solutions to store the lenses and do not top up the solution. That means if you still have remaining solutions in the casing, just pour them away, clean up your contact lens casing, and then use fresh batch of solutions. Do not just top up. And number six, do not overuse your lenses or expired lenses or even solutions. And following that, the don'ts are, if you're feeling unwell, sick, having fever, don't use your lenses. Do not shower. Do not use contact lenses when you're taking a shower. Do not sleep with your lenses on as well, unless the contact lenses are specially designed for overnight use. And following that, do not swim with contact lenses. If you need to swim, all right, with lenses on, then we will actually recommend to use daily disposable lenses. Just discard off the lenses after the swim. And lastly, if you do notice any redness, any discomfort, all right, of your eyes, do not use lenses. And the four main areas which contact lens users should pay extra attention to are: always practice good hygiene. We cannot stress this enough. And follow proper safety precaution when handling lenses. Number 2, exercise proper hand washing and dry them up before handling your lenses. We have actually observed in the private practice, even though we have taught this, emphasized this, and repeat this many times, there are still contact lens users who touch their lenses, who touch their eyes immediately after washing their hands while their hands are still wet. So don't do that. You should be drying up the hands after washing. Okay, use proper solution like the multi-purpose disinfecting solution, and don't use tap water and saline. And lastly, discontinue lens wear if you're sick or unwell. These 4 areas would be, I would say that please pay extra attention to, especially during this pandemic. Yeah. Back to you, Prakash.
Wow. Thanks, Ms. Liu. Thanks for the great sharing.
Thank you.
That was amazing do's and don'ts on contact lens use. I'm pretty sure that if we follow all the steps, we will never face any complications of contact lenses. Now, Georgina, next question is to you. Now, we know that we are amidst of COVID-19 pandemic. So how do you think the pattern of contact lenses wear has changed during this pandemic? Are there any specific types of contact lenses preferred by our users?
Okay, thanks for the question, Prakash. So before answering this question, I would like to re-emphasize again, as mentioned by all our panelists, is that there is no evidence to suggest that if you wear contact lenses, so you have a higher risk of getting COVID-19, right? So of course, when we had when the start of this pandemic last year, so generally, I think from the start, the consumers generally they are quite wary at the beginning. So there were some, the different concepts, right? And then some have already opted to switch to glasses. But as more scientific studies have been made known, all right, and we have known that COVID-19 will only get to you, you get infected if you are directly in contact with someone who's positive, so it's airborne transmission, or whereby some has sneezed on a surface and then you touch it with unwashed hands and you touch it on the face, then only you get the infection. So with this understanding that come through along the years since last year all the way to this year, we also do see the trend that there is also generally, compared in a monthly or disposable category, we do see more consumers they actually prefer the monthly modality lenses. And this is also true for the cosmetic lenses as well, because we know that, the fact is with the implementation of the work from home, and there's also less face-to-face meetings, right? So most of even the session we're having right now is also virtual as well. So there are also options whereby the consumers, they would, because they don't go out so often, right? So they will buy in bulk and packages, and most of them are the monthly disposable lenses. For example, in Alcon, we have our Air Optics Plus Hydroglide, and also they also purchase the solutions as well that comes along with it. Yeah, and this is also true for the cosmetic lenses to help to enhance their vision as well. So towards the end of the year, and right now we see that with the easing of the more socio-economic activities, and we generally see the growth, right, in contact lens categories, basically in the monthly disposable. And us coming right now into the phase 4 in the National Recovery Plan, I do believe that definitely there will be more contact lens fitting coming up next year as well. And it's also particularly in the astigmatism and also in the multifocal lenses. I hope that answers your questions, Prakash.
Yep. Thanks, Georgina. That was a good explanation. Okay. Now, Ms. Liu, I have seen some people wearing contact lenses for many years. They think that they have no problem. They are completely okay. But do you think these active contact lenses wearers, do you think they need to get an eye examination done by an optometrist? That's the first question. And how about, I'm a first-time contact lenses wearer. I've never worn contact lenses before, but now I'm planning to wear contact lenses. Shall I get an eye examination first?
All right, to answer your question, Prakash, I think I will talk more about the first-time wearer. That means they have not been using contact lenses before that, then only answer the second question. All right. So for users who have not tried out any contact lenses before, eye examination is very important. All right. It's not just about checking the refractive power of the eyes. All right. But then the optometrist or contact lens practitioner will actually use a device called a slit lamp biomicroscope. It's like a microscope to assess and also to check the condition of the anterior part of your eyes, specifically the cornea. The picture here shows the slit lamp biomicroscope. All right, the optometrist is performing the eye examination. All right, to determine the eye structures, whether they are healthy and they are suitable for contact lens usage. For example, if let's say someone is having dry eye issue, all right, so from the slit lamp examination, we'll be able to know that this person has a dry eye condition and what type of lenses are more suitable. And if let's say this is not done and a wrong type of lens is used, material-wise or even the fitting, the curvature and the tightness of the lens, a wrong one is used or prescribed, then it will actually affect the tear film spreading, the spreading of the tear film. It will cause dryness and it will also cause other complications as well. Okay, so therefore it's very important to assess the eye condition to determine whether a person is suitable or whether there are any conditions which are contraindication for contact lens use. Okay, there are some people who have redness, okay, sensitive eyes. So from them we'll be able to advise properly. All right. As for active contact lens users, that means they have been using contact lenses all this while. All right. Of course, you should be going for your first assessment first, and then followed by checkups. All right, periodic checkups, for example, every 3 months or every 6 months, depending on the type of contact lens being used. All right, it's also not to just check your vision or to assess the refractive power, but is also to monitor. The purpose is to monitor the condition of the eyes, whether along the way when a wearer continue to use contact lenses for long term. All right, whether is there any complications that develops over time? For example, dryness, okay? For example, some redness, all right? Especially when the lenses are improperly fitted. Therefore, contact lenses have to be dispensed, all right? And prescribed by qualified contact lens practitioners, and they should not be just bought online, okay? Or any stores or even any night markets. All right. So do you think, Prakash, do you think you have seen, I know you do, you provide a service, optometry service in a clinical setting. Do you often see, patients that are, coming to you and they buy online and things like that?
Not really, but I have seen people like wearing colored contact lenses without power. So they've been happily wearing contact lenses for many years. And then when I ask them, have you got your eyes checked? They say no. But now we understand, Ms. Liu, that being a first-time contact lenses wearer or active contact lens user, we have to get the eyes checked by an optometrist. Because as you say, right, we need to check on the suitability of the contact lenses on different eyes, right?
Yeah, because contact lenses are medical devices. They have to be prescribed and not just bought online or like a shampoo or any commodity from any stores.
Right, understand. All right, now, since we have an ophthalmologist here, Dr. Vanita, I want to get your experience. Have you seen any cases of contact lenses related complications? Like, what are the cases that you have seen that arising from improper use of contact lenses?
Every year, it's estimated that 1 in 20 contact lens wearers will develop an eye problem, and this is usually from poor handling or poor contact lens care. One of the more dreaded complications is a corneal ulcer, which is an infection in the front part of the eye, in the cornea, and patients present with redness, pain, a lot of discharge, and a drop in vision. And as you can see, it can cause blindness. Other problems include corneal abrasions, which can occur when you're putting in or taking off the contact lens. But having said that, it's very common for contact lens wearers to have micro abrasions on their cornea, as well as a reduced corneal sensation, which does put them at increased risk of developing corneal infections. And even if you wear your contact lens for too long, it can cause the surface to break down. One of the other things that can happen with contact lens overwear is what we call corneal hypoxia, which is a reduction in the oxygen supply to the cornea. And this can cause the corneal surface to break down as well. And of course, finally, a poorly fitting contact lens can cause a distortion of the cornea, and this can affect one's vision. So as Ms. Liu mentioned earlier, it's very important that you get your corneas checked. It's not a one-size-fits-all. Everybody has a different corneal surface, so you may not be in the average zone. So it's really important that you get your corneas examined to see whether it's suitable for contact lens to begin with, as well as to see the fit of the contact lens.
Right. Thank you, Dr. Vanitha. The pictures that you showed looks quite scary. So I believe our viewers will they will be a bit careful in contact lens use, because we know that contact lens is supposed to be a transparent layer, right? So if there is an ulcer, it's going to impair our vision. And
that's right.
Yep. So it's quite scary. So I think we should follow all the steps. Yeah. So back to Ms. Liu. Ms. Liu, you were telling that slit lamp examination need to be performed, right, for all the contact lenses users. So
that's right.
How frequent do you think regular contact lenses wearer need to be checked with slit lamp?
Yeah, it depends on the type of lenses they're using. Basically, if let's say someone is using disposable lenses, I would say that they should be seen at least every 6 months, okay? If let's say it can be every 3 months, it will be even better, depending on the condition of the eyes as well. Certain type of contact lenses, especially the customized specialty lenses, keratoconus lenses, or even auto-K lenses, may have to be assessed more regularly, probably every 2 months or even 3 months, yeah, to make sure that the cornea is healthy. All right. But in general, if let's say majority of contact lens users are using disposable lenses, I would like to suggest to have their eyes checked by a slit lamp microscope at least every 6 months.
Right. So that means we are seeing an optometrist not just for eye power checking, right? So we're also getting our eyes checked properly in terms of eye health.
Corneal health.
Yeah, that's great, because some of us may think that I'm wearing contact lenses, I just need to check my power, is it updated or not? But there are more aspects, the more important aspects we need to look at. All right. Georgina, I have another question for you. Just now, Ms. Liu said contact lenses is a medical device. I think you'll be the right person to answer this, because you're from the Elkin, so you know better. How contact lenses are known as part of medical devices? And if it's medical devices, can we only get this from authorized primary eye care providers?
Okay,
can you
thanks for the
elaborate on
question.
that? Yeah.
Sure, thanks for the question, Prakash. So going to the very first question is, our answer is whether contact lens is part of a medical device. So yes, we have a regulations on the guidelines as on how to fit and the selling of these contact lenses. So it's all governed under the Malaysian Optical Council, under the Ministry of Health. All right. So it's already categorized, right, as a medical device, right, and it's used to correct any refractive error, as cosmetic, and even restore any abnormalities on the patient's or the customer's eyes. Right, and it's stated very clearly as well that only registered optometry practitioners, they are allowed to conduct the sale of contact lenses online as well. So why is that? To come on to the second question is, you're asking if we should only get from authorized primary eye care providers, right? And why is it so? Yeah, so the reason is because when we actually buy from eye care practitioners, is someone who's already mandated, given this authority, all right, and has been trained, right, to actually, they know about the contact lens in and out. That's why they've been trained to learn to how to examine the eye conditions and how the fitting of the lenses, whether it fits this customer's or this patient's eyes or not, right? So the risk is if someone just buy contact lenses off from someone over the shelf, there's no directions or there's no instructions to how to take care of it. You will prone severe risk, all right? So that's why it's very important here on follow manufacturer's ECP's guide on lens care, because please understand that contact lenses, they are medical device, so they are not, it's not like one size fit all, right? Even for our clothes. So we have different sizes, S, M, and L, right? But for contact lenses, they come in different parameters as well, the diameters, the base curve, all right? So the lens, the material as well, it may suit me, but it may not suit you. So from the angle of an eye care practitioner, they will measure each eye to make sure that it fits this customer as he or she need. All right, because we know if the lens, if it's too tight, it's not good either, because you're not giving enough oxygen to the eyes. If it's too loose, it's going to cause discomfort, it's going to affect the vision as well. All right, and moving on to the next one is the increased risk of poor lens hygiene. So earlier on, you've heard from Miss Liu, right? From when you visit an eye care practitioner not only will just examine your eyes, all right? And then after that, when they check your eyes, your power, and then your situation, the condition of your eye, whether it's suitable for contact lens or not. The next thing what they will do is, when they have already prescribed you the right power as well, they will also advise on how to put on your lenses, how to remove them, and how to care for it, right? Because we know, right, if whether it's pandemic or it's non-pandemic as well, when you have a contact lens on your eyes, it's something that you put onto your eye directly. So the hygiene and the correct compliance according to the manufacturer's guide is very important. So I like to stress a little bit on about, Miss Liu mentioned about the solutions, right? So if you know that you're using a monthly disposable lenses, you always remember, you cannot just pour into the lens case and just leave it there, right? The right way is you have to clean it. And in clean, it's not just about rubbing 1 or 2 seconds, it's the correct way. So let me just spend a little bit of time here to add on what Miss Liu has explained earlier on about the solution. Remember, she mentioned never to top off, right? Always use fresh solution. So, and remember, every time you clean your lenses, you don't contaminate, or I would say you don't get your contact lens indirect with the water, all right? It's a correct way of doing it. So an eye care practitioner will teach you, right, that how you should clean the lenses, how you store it as well. And these are very, very important. Okay, so for example, like in Alcon, we have our Opti-Free solutions, and they are certified as multi-purpose disinfecting solutions. You can look up this online, all right? And when you have an encounter with an eye care practitioner, which is what you should do before getting your contact lens fitted on your eyes and before buying them, then they will teach you, right, what is the right way. So I will reiterate here, which is you have to rub to clean the surface, 20 seconds on both sides, rinse it for 10 seconds, and then you make sure that you put it into the lens case. And remember that every time you take out, you have to just quickly rinse it off with saline. Also, only you put it back into your eye. And all these are very important, because at the end of the day, we want to enjoy a comfortable lens wear experience. And please remember also, if the ways of cleaning and storing your contact lenses are not correct, you actually put yourself in the risk of getting any infections. You've heard from Dr. Vanita, she mentioned about cornea ulcer, or even like bacterial keratitis, right? Microbial keratitis, right? So all these are prone to risk, right? So that is why it's very important. My main point here is that whether you are getting your contact lens, whether it's cosmetic, whether it's with power to correct your vision, it's very important you have to see a certified eye care practitioners, get your eyes checked, get the right prescription, and follow the instructions as per guided by your ECP.
I understand, Georgina. Thanks a lot for such a very detailed explanation on cleaning method as well. Now, Dr. Afzam, Georgina has explained about the method of cleaning the lens, but do you think there are any other special cleaning methods involved during this COVID-19 pandemic, to get rid of coronavirus?
All right. Thank you very much for the question, Mr. Prakash. And in fact, it's actually one of the questions that one of my few close friends asked me during the beginning of the COVID pandemic earlier on. So what I mentioned to the public is that, first of all, they have to understand that when it comes to contact lens solution, they have to understand that all this solution, they have undergone all this rigorous testing protocol, and subsequently, these solutions are going to be approved by the Food and Drug Administration, normally in the USA. Now, to answer this question, I'm going to take up 2 points. One is from the international body of the College of Optometrists and the British Contact Lens Association in the UK. And then later on, I will talk a bit about in the USA, where they have this Center for Disease Control. Now, when it comes to the College of Optometrists and the British Contact Lens Association, what they have is that they mention that when it comes to contact lens solution, there's actually no differences to which solutions works better. In a sense, they say that solution A does not particularly works better compared to solution B. So having said that, they also emphasize that as long as the public takes a good care of the takes a good care of the contact lenses, then their contact lenses and the lenswear should be okay. However, in the USA, the Center for Disease Control and Prevention, or what we call the CDC, they released a statement mentioning that hydrogen peroxide-based system should be effective against the virus that causes COVID-19. Now, although this statement is actually being mentioned by the CDC USA, we have to remember that they do not mention that hydrogen peroxide is actually better than multipurpose solution. No, it's just that for this particular instances, the CDC only tested hydrogen peroxide and they did not test multipurpose solution with contact lenses. And having a conversation from some of my colleagues in the UK, they also emphasize that please do not be worried as long as you use the proper cleaning procedures and use the solution as being recommended by the manufacturers, everyone should be safe. So the take-home message is that as long as you adhere to the points and the way on how to properly use the solution, the public should be safe. Thank you.
Thank you, Dr. Afzal. So that means that we have to follow the proper cleaning method, and it's the same for whatever contact lenses and also whatever solution that you're using, right? So as long as we follow the proper care regime prescribed by the optometrist, we are safe, right? Okay, Dr. Vanita, I have a question to you. Let's say if I am found positive for COVID-19, can I wear contact lenses?
Okay, so if you anytime you have the flu, whether it's COVID-19 or just a common cold, you shouldn't be wearing contact lenses. We know that when we have the flu, your eye is already irritated, and contact lens wear will further aggravate this. In cases when you have the flu, it's also important to remember that the virus can actually be transmitted from droplets from the respiratory system onto your hands, and then handling your contact lens and putting it into your eye can potentially spread the virus to your eye to give you an eye infection. And of course, if you already have an eye infection, then there's usually virus in your tear film, and using a contact lens can potentially prolong the viral infection. So generally, as long as you have flu or you're not well, stay away from your contact lenses. That's a good time to give your eye a break. Of course, if you have recovered from COVID and you have got you're symptom free, then it's fine to go back and you can safely wear your contact lenses again.
Yep. Thank you. So that means I can conclude that generally, if we have any flu-like symptoms, better not to wear contact lenses. Am I right, Dr. Vanita?
That's right.
Yep. All right, I think we should really take note of this. Okay, so next question will be to Dr. Afzal. Dr. Afzal, I've seen that some children are wearing contact lenses. Is it safe for children to wear contact lenses anyway?
You know what, Mr. Prakash, this is actually one of the most famous questions being asked by all parents when they come to optometry practice. And I'm really sure that this is also true for all optometrists in all over Malaysia. Now, what I'm going to say is that this is going to be based on research base, of course. A lot of research that had proven that children are actually quite okay and safe to wear contact lenses. Of course, this is provided that they are being examined by a qualified optometrist. Now, although I mentioned that children are okay to wear contact lenses, we have to remember that this is not true for all children. Of course, some children with specific characteristic of the eyes, they are not suitable for contact lens wear. And how do we know which children is suitable and which children are not suitable? Well, this is why we go to optometrists to have a preliminary eye checkup to determine whether that particular children is actually suitable or unsuitable for contact lens wear. And once we had identified that that particular children is okay to wear contact lenses, we then do a few things, a more examination. We instruct the children and the parents on how to properly insert the lens, remove the lenses, care for it. And of course, we also teach the children and the parents on how to monitor for any signs of adverse reaction. And lastly, we require the parents and the children to always come for what we call the aftercare visit, where they have to come after a certain period of time, as what Ms. Liu had clearly mentioned just now.
Right. Thank you, Dr. Afzal. Dr. Afzal, can you share with me how many hours a person can wear contact lenses in a day?
That's a really good question. Now, when we ask about how many long per hour can a patient or an individual wear contact lenses, it's actually based on what type of contact lenses that particular patient is wearing. To put things to a simple perspective, a contact lens that enables a higher percentage of oxygen to go through the cornea can be worn through the eyes. And if the publics are not sure which contact lenses are better for prolonged hour, I think we can always go back to any optometry practice and they can clearly help you to choose the most appropriate contact lenses for that particular patient to enable either for a long-term or short-term wear. But typically, they range about from 8 hours to perhaps some contact lenses. I think with the ophthalmologist, they can be worn directly for 7 days for bandages purpose, right, Dr. Vanita?
That's right. You can wear a bandage contact lens, for about a week. We even have 2 weeks, a month, but that's only special circumstances, and we don't recommend. Don't try it at home.
Exactly. I'm not advocating to be using this at home.
Right.
Yep. Thank you.
It's just for therapeutic, right? It need to be carefully monitored, closely monitored.
Mm-hmm.
So generally, I would say that not more than 8 hours, right?
That's very true.
Yeah. Okay. Next question to Ms. Liu. Ms. Liu, I have seen some contact lenses wearer using eye drops. Like, what kind of eye drops? Do you think that there is a need to use eye drops when we are wearing contact lenses?
That is a wonderful question. I believe there are also some contact lens users who are using eye drops because their eyes are dry and they keep asking what sort of eye drops are suitable for them. All right. So basically, if let's say we can show this slide, in front of the cornea, there are layers of tears lubricating the cornea. The tear layer function as a protective layer to the eyes by washing away dust or debris that enters the eyes. Okay, so in contact lens wear, the tear layer function as a cushion between the lens and the cornea, and it helps to lubricate and ensures the comfort of wear. When there's a contact lens worn over the cornea, this may disrupt the spread of the tear evenly, all right, especially when the lens is poorly fitted, for example, fitted too tightly, as tightly fitted lenses disrupt the tear flow underneath the lens. So in long run, this may cause dryness. Therefore, eye examination, a comprehensive eye examination, especially to assess the anterior part of the eye, the corneal structure is so important, right? For optometrists or for contact lens practitioners to determine what sort of lenses, all right, what sort of measurements, curvature, and also what sort of eye drops, all right, are suitable based on the condition of the eyes. All right, so therefore, if let's say you're contact lens users and then your eyes are dry, you can safely use artificial tears, all right, especially those that do not contain a preservative called BAK, benzalkonium chloride, all right, because this preservative, all right, if let's say it's being used, the eye drops is being used for too long or too often, the eye drops that contain this BAK, all right? So it can actually cause some toxicity to the eye, to the cornea. So do use eye drops, check with the optometrist or even check with your pharmacist. Check with them what sort of eye drops or lubricating artificial tears which contain preservative or has a composition or formulation which is suitable or compatible with contact lens usage. So not all eye drops are suitable to be used together with contact lens wear.
Right. Thanks, Ms. Liu. So there is an indication to use eye drops or artificial tears when we're wearing contact lenses.
Yes,
especially for lubricating.
Yeah, so if let's say a person's eyes are really too dry and have to use the drops more often, like more than 4 times or even more than 5 times a day, we would actually normally recommend
Right. Okay. Thanks, Ms. Liu. Now, let's move on to Georgina. Georgina, can I buy colored cosmetic contact lenses from street markets or pasar malam? Because I think we always see, right? Pasar malam, they're selling colored contact lenses. They look so attractive, and they look even cheap. I mean, they even cheaper than the contact lenses that we get from the optometrists. So I want to know, how different are these contact lenses from the ones that we get from an optometrist?
Okay, thanks for the question, Prakash. So yes, cosmetic contact lenses are very popular because it enhances our eyes, right? Makes our eyes bigger and more beautiful, and we wear it for all sorts of occasions. And as mentioned, yes, it's easily available. So if it's so easy to get to the street markets, or even we call it pasar malam in Malaysia, so there is actually a chance of counterfeit and unapproved cosmetic contact lenses. As we know, I mentioned earlier on, contact lenses are a medical device, and they are actually governed under we have the Optical Act, right? And then who can sell and who can prescribe you contact lenses. But some of these contact lenses, they have go through unregulated routes, all right? So if they get to the hands and to the, for example, in the street market, so there is a chance whereby that product, it could be a counterfeit product, or it could be a product that's not been approved by the US FDA to be safe to be used, all right, or to be worn on the eyes. So why is that we don't recommend of buying cosmetic lenses off the street, like for example in pasar malam or even from the beauty vendor shop, right? So as we know, right, cosmetic lenses, there's color pigments, all right? And we're putting the contact lenses directly on our eyes. All right. So let's say if this product, all right, because it goes through, you buy it from a street vendor. So we're not sure the originality or where does this product route through. It comes from where? We don't know the source, right? So there is a chance whereby this product could be a counterfeit. It may not be the original product, but they probably mimic it to be very close to the original product packaging. So what happens is, very important is we look is on the cosmetic lenses. We know the colors are printed on the lenses, right? So the right way is to have the pigment to be encapsulated within the material of the lens itself and not on the surface of the lens, all right? So for example, let's say if this product, if it has not passed through the US FDA standards, okay? For example, it's unauthorized, it's not approved, right? So what happens is if it's directly printed, okay, it didn't pass through the standards, and then you have it on your eye, there is actually a chance whereby some of these pigments, it can get seeped into our eyes. So this can result in toxicity. And in fact, right, researchers have found that they found even in unauthorized or unapproved cosmetic lenses which are sold, they found to have some have even chlorine or even iron on it. And then they actually found that after rinsing it, it actually gets seeps into the cornea. And this is very, very dangerous to a wearer because it can really result in the iron toxicity and it's extremely dangerous. Okay, and the next thing I would like to also focus on is the way they manufacture, because as we know, if this product is let's say you get it from a street vendor, right? So maybe the person who sells you the product may not have a very clear understanding on how the color is printed, how is it manufactured. So there is a chance whereby the pigment, it could be uneven, all right? And you know that if uneven surface, although we don't feel on our eyes, but it will cause friction or say trauma to the eyes. So, and this usually happens if that product is not approved, right? For example, here you see the pointer, unestablished quality and safety. So this actually proves a risk because we don't know where the product comes from. We don't know how is it manufactured. We don't know how is the color printed on the lens itself. Is it encapsulated within, which is what it is supposed to be, or is actually on the surface? And there is a chance whereby these colors, these pigments can get onto your eyes, and it's very dangerous. Okay? So that is the reason why we will not recommend consumers to directly buy from street vendors, because it's really very dangerous, and we don't know where the source of these products come from. Okay, and that's why I would also like to emphasize, so if you have a chance, if you actually buy a cosmetic product, cosmetic contact lenses, please get it from eye care practitioners or optical shops. They have certified eye care practitioners to actually really guide you to actually see through your eyes condition and recommend what is the best for you.
Right. Thanks, Georgina. So we know that the technology of producing color cosmetic lenses that being sold in Pasar Malam is not good. No wonder it's very cheap. And we need to remember about the side effects. The color might just leak. Gosh, I can't imagine that the color is leaking into our eye. And I think those patients will end up with Dr. Vanita at the end. Right. Okay. Georgina, we have a question from our viewer. The question is, what is the difference between multipurpose solution and multipurpose disinfectant solution? And
okay. All right. So that's a very good question. Sure. All right. So generally, right, in the market, we actually do categorize. They have to go through a test, right, to see whether it fits into the MPS or MPDS group. So I don't have the video to show you today, but you can also look up at it. I'll just narrate it from my understanding and what has been stated and has already showed and proven by studies, is that the solution, right, before it's released into the market, it has to go through two tests, all right? One is the basic test. If it passes this test, all right, it's able to meet the minimum FDA standards to kill the bacteria and to kill the virus, right? Which is, just to let you know, FDA standard for bacteria is 3, and then for fungi and yeast is at 1, all right, because it's more difficult to kill. So then it's certified as MPS, okay? But for a solution to be categorized as a multi-purpose disinfecting solution, MPDS, it has to go through a more stringent test. So that test will, in a way, simulate the actual way of the wearer putting on and cleaning and storing the lenses. So because it's such a stringent test, right? If a solution it passed through this test, then only it will be certified as MPDS. And if we compare the percentage-wise, if for MPS, they actually kills up to 90% of the microbes, right? Whereas for MPDS, up to 99%. You can look up this as well. And just to emphasize here is that, for example, in Alcon, all our Opti-Free series solutions are categorized as the MPDS, right? For Express, Replenish, and Pure Moist. So of course, if we want to tell our patients as well, we always recommend the best for our patients, right? And there's also one more thing is about the gentle. The solution should be effective in cleaning, but it should at the same time, it should be gentle to the eyes as well. Yeah. So Of course, I hope that gives a better explanation on what MPS and MPS is all about.
Thanks, Georgina. I think if our viewers got more questions on that, they can always look for you. Yeah. Right. Next question, Dr. Afzam. We all have been wearing masks for very long. I mean, since ever this COVID-19 started, all of us have to wear a mask. And I've heard about mask-associated dry eye. And apparently, prolonged use of face masks can aggravate dry eye. Is that true, Dr. Afzam?
Thank you very much, Mr. Prakash. The short answer to that particular question is yes. However, when I mentioned that wearing a mask does aggravate dry eye, I do not emphasize that we should not be wearing masks. That's a total no. We should still be wearing masks to prevent the spread of COVID-19. Now, the reason why the mask-associated dry eye, or what we call MAID, occurs is primarily because, for example, here I have a mask because I just came back from work. When we wear masks, what happens is we always cover our chin here properly. But the problem arises is in this top part. Because we're not like Caucasians that we have hidung mancung. Most of us Asian has slightly not that mancung hidung. So when we try to push the metallic parts on the upper portion of the mask here, what's going to happen is that there's still going to be some area which enables the airflow that comes out when we breathe throughout the nose to move upwards and then reach our eyes. So when that happens, as we know, when there's a faster rate of airflow, it will stimulate a more faster tear evaporation. And because of this faster airflow, an increased tear evaporation occurs, and thus the tear breakup time or the tear stability will destabilize a lot faster compared to when we're not wearing a mask. So this is why mask-associated dry eyes occurred when we wear a mask for a long period of time. Now, having said that, it's not to say that we should not wear a mask, but instead we should wear a mask properly. How to do it? We should wear the mask. We should make sure that the masks are properly secured and fastened to our face by ensuring that the metallic parts are fitted as close as possible to your facial structures. And this might be a bit of an overkill, but it's not an overkill. What we can use is we can use a micropore medical sellotape, and we just take a small portion of it, tear a bit short portion, and then we can actually glue that, paste that on the upper portion of our nose and our bridge. And once you seal that airflow off, what will happen is it will not cause the airflow to move upwards, and thus the mask-associated dry eye will not occur. And apart from that, you can also use ocular eye lubricant, as mentioned by Ms. Liu, because it helps to solve the problems of ocular dryness. But of course, I have to mention that this idea does not come from me. It comes from other researchers, which I'm sharing with you all today. I believe that is all for me to share. Just don't use the strong cellophane tape. You'll end up with, torn flesh and skin, which is not cosmetically beautiful.
Right. Thanks a lot, Dr. Afzam, for showing us the proper way of wearing face masks. I think the important is pressing the pin, the metal pin, right? The metal piece towards our nose.
Yep,
and
exactly.
Thanks a lot for showing us that demonstration. Now, we have discussed quite a lot, right, about contact lenses. Now, apart from contact lens use, Ms. Liu, what are the importance of seeing an optometrist at least once a year? We always tell that see an optometrist at least once a year. So what do you think? What are the importance of seeing an optometrist at least once a year?
Yeah, so even for non-contact lens users, it's very important for the public to have their eyes checked on a yearly basis, similar to having your dental checks. So eyes should be the same as well, because any abnormalities can be picked up and detected at an early stage, and then further damage to the eye can be prevented, can be detected early. All right, and we can also help out as an optometrist. We can also serve as a primary eye care provider, all right, to pick up all these complications and then refer them to eye specialists like Dr. Vanita, right? So that the necessary medical attention can be rendered, and further precautions can be taken, right? So therefore, it's very important, for the public to have their eyes checked. Whereas for contact lens users, I would suggest not to just check once a year, but it should be more regularly, at least 6 months, every 6 months, or even three months. Georgina, would you like to add anything in terms of this?
Thanks, Ms. Liu. Yes, so Ms. Liu explained it very well, so I just add a couple of lines over here. So we mentioned, and we kept emphasizing from the beginning of the session up till now, the importance of seeing an eye care practitioners and getting your eyes checked and getting the fitting done before you put your very first pair of lenses or you replenish your contact lenses. Because like I say, what fits me well may not fit you well, right? Like I say, because there are different type of lenses in the market, and they all comes with different readings, right? Their base curve, right? And whether it's the diameter, the rigidity, the water content. So as again, I've said, by seeing an eye care practitioner, you get to assess not only your eye vision, but also how well does the contact lens sit on your eye. And by seeing eye care practitioners, they are the best people to actually advise you on how to put on, how to remove, how to care. So it's basically covering the entire thing, which is from your vision all the way to eye health. And of course, further on to that, there is also very important, which is like Dr. Vanita herself, right? Ophthalmologists, because they are the ones that help to see the condition and make sure your eye health are in check. Yeah.
Right. Thanks, Georgina and Miss Liu. Now, next question. I think this will be the last question to summarize everything. Dr. Afzam, we have been telling that we have to see an optometrist or eye care practitioners, but how to know if an eye care practitioner is qualified to examine the contact lenses use of, contact lenses use? Can you elaborate on that, Dr. Afzam?
Okay, thank you very much, Mr. Prakash. I believe that that question is one of the best questions for today, because as a public, they might not know how to actually identify eye care practitioners that are qualified to fit contact lenses. Now, for the public, we have to know that in Malaysia, we have what we call a body that monitors the eye care practitioners, and it is actually called the Malaysian Optical Council. And this Malaysian Optical Council is under the purview of Kementerian Kesihatan Malaysia, and it actually governs and regulates the professions of optometry and opticians in Malaysia. And lucky for us, they have actually give us a way on how to identify qualified eye care practitioners easily. And essentially, what the public has to or needs to do is just they have to go to the practice and ask or look out for any certificate. If you have a look at the screen right now, the left side of the screen shows a green certificate, and this will signify to you that that particular practice or that particular individual is a qualified optometrist that can examine the eyes and fit contact lenses on you. And in the middle is another form which shows that that particular individual is a registered optician, but they are unable to fit contact lenses onto your eyes. However, the form on the far right of the screen, which what we call a pink form, will denote an optician that had gone through some training and are qualified to fit contact lenses onto your eyes. So the take-home message is that if you want to fit contact lenses onto your eyes, you should be looking for eye care practitioners, optometrists that has a green certificate on the far left, or opticians that has a pink certificate on the far right. I hope that answers your question, Mr. Prakash.
Yes, Dr. Afzam, that's a very good representation that I think all of us can remember that it's either green or pink when it comes to contact lens wear.
Yep, exactly.
Like green is an optometrist. We have been emphasizing seeing optometrists. So I think we can be very sure that from now on, anyone that walking into optometric practices, we should look for these certificates. And I think most of our viewers now are clear about these color guidelines, just like we have guidelines for our My Sejahtera. Right, so it's been about an hour discussing about contact lens wear during this pandemic, and I think we have shared quite a lot, right? So we have to summarize anyway. I would like to ask take-home messages on good practice of contact lenses wear, especially during COVID-19 pandemic. Dr. Vanita, do you have any take-home messages for us?
Yes, thank you, Prakash. So I think to sum it up, I'd say wear contact lenses responsibly. Yeah, so just a few things: disinfect, disinfect, disinfect. So wash your hands, clean your contact lenses, and don't forget to clean your contact lens casing as well. Yeah, it's very important. You know, sometimes the source of infection is really the casing. So make sure you clean your casing. When you buy your contact lenses, buy it from a certified practitioner, as you've heard of today. I had a patient, she was a young schoolgirl, and she had bought some cosmetic contact lenses from the Pasar Malam, the night market, and went to school. She was excited, her friends were excited. They were sharing that pair of contact lens among themselves, the few of them. She came with a really bad infection, and while we managed to sort out the infection, you know, it's caused a permanent scar on her cornea, which has affected her vision. So it's really important that you responsible with your contact lenses, and that's where getting a certified practitioner who knows how to teach you what the do's and don'ts are is really important. And finally, I'd also like to mention that even though you are wearing contact lenses responsibly and you are comfortable with contact lenses, it's really important that you always have a spare pair of glasses. So I've had patients come in with contact lens, with corneal problems, and obviously at that time you can't wear your glasses, but because they're so comfortable wearing contact lenses, they don't actually have a spare pair of glasses. So make sure you always have one on standby. Yeah, so I think that sums it up. Thank you very much.
Thanks, Dr. Vanitha, for a great summary. How about Ms. Liu? Do you have any take-home messages for us?
Yeah, my take-home message for today would be for the public, all right, this is to the public, to actually purchase your contact lenses from qualified practitioners, and do not purchase them online or any pharmacies or even any night market, because your eyes deserve the proper care from qualified practitioners to take care of your eyes. Eyes are precious to us, all right? We really depend on them to function, all right, to work. So therefore, do not take our eyes for granted. We only have one pair. Once it's gone and cannot be replaced, all right? So sometimes medical attention also can't help in some situation. So therefore, it's very important to take care of our eyes, all right? So if you're contact lens users, have your eyes checked first, all right, before being prescribed with contact lenses, and attend a regular follow-ups, because complications can take time to develop, all right? It can develop over time, which we are not aware of. It may not happen within 1 or 2 months. It may happen probably 5 years down the road and things like that. So therefore, follow-ups are very important. So do attend your checkups. And thirdly, if you're a contact lens wearer, do ask yourself these 3 questions, whether you're a disposable lens wearer or specialty lens wearer, custom-made lenses, all right? Whether you're seeing well with the lenses, all right, when you're wearing them, whether you're feeling well, all right, whether there's any discomfort, all right, any pain, any grittiness sensation which is abnormal, all right, in that way you should be stopping lens wear. And thirdly, you should be looking well. That means there's no ugly side, no swelling, no redness, all right? So you should see well, feel well, and look well with contact lens wear. Thank you. Back to you, Prakash.
Thanks, Ms. Liu. Thanks, Ms. Liu. So we really had so much of information today. And the most important, as Dr. Vanitha said, disinfect, 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 and follow proper guideline or instruction given by your eye care practitioner. And most importantly, see your optometrist at least once a year. And even if you're not wearing glasses or contact lenses, it is important to see an optometrist. So with that, we have come to the end of the session. I would like to thank all of our 4 panelists. Very wonderful sharing. All have experiences. You have shared your experiences, your knowledge from your own expertise. Thanks a lot for being with us today. And hope we can meet again in a similar show. Right. So we have come to the end of the session. Now, as I said, NEHA, National Eye Health Awareness Campaign, is organized by Association of Malaysian Optometrists, AMO. So we do this this campaign every year to educate the public on the importance of getting your eyes checked by your optometrist. So we already had 3 live forum. The first one we had on children's eye health. The second one is digital eye strain, and today we have on contact lens wear during the pandemic. All these sessions are available on our Facebook. You may always go back to our Facebook page to, if you missed anything, any important information, you can always go back to our Facebook to watch this. Our Facebook page is, you can just type it out, Association of Malaysian Optometrists. Beside these live forums, we are also doing Instagram challenge, where you can actually win few gifts, each gift worth of 600 ringgit. So as for today's session, we have Instagram challenge, that you may win our air purifier worth of RM 600 ringgit. It's so easy to win this. All you need to do is you have to follow our Facebook page. It's named Association of Malaysian Optometrists, or our Instagram. You can just type it out, Optometry Malaysia. You have to follow, upload any photos that related to contact lens use. You may upload that, a picture of you with your optometrist, or a good practice of contact lens use, and so on. You just upload and tag, okay? You have to include the hashtag NEHA 2021, hashtag eyes under lockdown, hashtag Alcon MY. So the photos with most likes will be chosen as the winner. Okay, we have this. We have more exciting prizes to come in Instagram challenge as well. The second gift that we have for our viewers is the scooter. Yeah, this is the foldable scooter. So this challenge was released after our first live session that was under children's eye health. So to win this scooter, again, the same step, you have to follow our social media, Facebook or Instagram, upload a photo related to children's eye health. You may upload your kid's photo wearing glasses or having a good visual habit. You can upload it and again share the tag. For this, you have to share the hashtag of NEHA 2021, hashtag eyes under lockdown, hashtag ESILAWMY. And we have the last gift for our Instagram challenge. That is the neck massager. Yeah, so this is also worth of 600 ringgit. It's a very good one. To win this, again, follow our Facebook or Instagram, upload your photos related to your computer use. If you watched the previous live session, our speakers have shared on the good practice of using computers, digital gadgets, and so on. So related to that, all right? So you may upload the photos and include the hashtag of NEHA 2021, hashtag eyes under lockdown, hashtag Kodak lens MY. All right. And we have our grand challenge for our NEHA 2021, that is Eyes Under Lockdown Online Treasure Hunt. And you'll be surprised that you may win 1,500 ringgit as the first prize. And we also have 800 ringgit, 500 ringgit, and 100 ringgit for each team. So grab this chance and join our virtual treasure hunt. And the initial deadline was set for 25th October, but due to overwhelming support, overwhelming responses we are getting from our viewers, we have extended the deadline. And the new deadline is on tomorrow. So hurry up. You may go to our Facebook page, get more information on how to join this online treasure hunt. And I'm very sure this is going to be a very fantastic, very exciteful session. On top of that, please stay tuned on Bernama TV on 8th October, on 10th November, it's on 10th November 2021 on Wednesday at 9:30 to 10:30 p.m. because we have Dato Murphy Chan, our advisor for AMO, and our president, Mr. Ahmad Fadullah. They both will be sharing on National Eye Health Awareness Campaign and the good eye care practice that we should have on this live talk show entitled Ruang Bicara. So again, to get more information, please visit our social media. You can also visit our website, amo.org.my. So with that, we have come to the end of the session. And once more, I would like to thank all our panelists and also all our viewers. Thank you, and see you soon in upcoming events.
Thanks, Prakash, and thanks everyone.
Yeah.
Good to have everyone
Thank
here.
you. Yeah,
Thanks for having me here.